afternoon. My name is Kareli. I'm gonna be your nurse practitioner today. Before we do anything, I just want to get your consent for recording and to upload it in YouTube so my professor can watch it. Okay, so today I'm gonna be doing a respiratory assessment, front and back. I'm gonna start the assessment by looking at the chest. I look to see how the patient's respiratory rate is. Make sure it's not too slow or too fast. In this case, the respiratory rate is normal. There are no retractions noted. There is no use of accessory muscles. Also, there are no chest abnormalities like a pectus carinatum or a pectus excavatum. Another thing I can look at pertaining the respiratory is the patient's fingers, and I check for clubbing. In this case, there's no clubbing. I also check the patient's lips. There's no cyanosis noted, which means that the patient has good oxygenation. The other thing I can look at is at the AP ratio, which would mean that I will mention the patient's side and compare it to the patient's front, and the front should be 2 times the patient's side, which in this case is 2 to 1. Now I can proceed and I can do palpation. I check in intercostals to see if there's any pain. Do you feel any pain?
No.
Okay. And then I can also check the respiratory expansion, chest expansion. Can you take a deep breath and let it out? Okay. And with this exam, I'm just looking to see how my fingers move. It should be symmetrical. In this case, it's symmetrical. The other thing I can do is do tactile fremitus. Also, when I palpate, I check for crepitus, which will be that crackling feeling under my hands. Can you please say the words 99?
99.
And again?
99.
Again?
99.
Again.
99.
And again?
99.
Sorry. Again.
99.
Okay, with tactile fremitus, I'm checking for vibrations, which are equal bilaterally. If there will be asymmetric vibrations, there could be that there's an issue, either consolidation or too much air inside the lung. Now I can proceed and I can do percussion, which will be started at the apices of the lung, and I do percussion in the intercostal spaces, comparing side to side and making sure I cover all the lung fields, including the sides. Upon percussion, I could hear resonance, which is normal for the chest percussion. Now I can proceed and I can do the auscultation. Take a deep breath and let it out. Okay, so upon auscultation of all lung fields, there were lung cells were clear. So now I can proceed and I can do the patient's back. Can you turn the list? So again, looking at the back, I inspect first and I inspect the same to see if there's any accessory muscles being used. I check for expansion or any retractions, and there are none. I can also check for lesions, which there are none. And I can do the same. I do palpation in between the intercostal spaces to see if there's any pain while doing this. And I can also check for crepitus. I can also check the expansion. Take a deep breath in and let it out. And it's symmetrical to both sides. The next step I can do is do the percussion, and it will be, of course, in the intercostal spaces and comparing side to side. And also the sides. Upon percussing, there was resonance noted, and that is a normal finding. The other test that I can perform here is percussion for diaphragmatic excursion. I'm gonna ask you to take a deep breath in, let it out, and take a deep breath in, and hold it. Okay, let it out, deep breath in, let it out, and then hold it out. And right here, what I'm looking is for that dullness, and we can also measure it in centimeters. The normal finding will be anything between 3 to 5 centimeters. In this case, it was 3 centimeters for him, which is our normal finding. And I will do it on one side and compare it to the other. Now I can perform a auscultation in the back. Nice deep breath in, let it out. And once again. And then I compare it side to side. All lung sounds were clear to all lung fields, and I can do a specialty test while I'm here, and this test is called bronchophony, and it's gonna be used to identify if there's any abnormalities in the lungs. And I'm gonna ask the patient to say 99 every time I put my stethoscope in your back. And the word to be heard muffled. That will be a normal finding. Please say 99.
99.
And again.
99.
Again.
99.
Again.
99. 99. 99. 99. 99.
Okay. And I can do the same specialty test in the front.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. And I did it in ladder fashion to compare side to side, both anterior and posterior. The word 99 was heard muffled, which means that it's a normal finding. There's no consolidation or no excess air for pneumothorax or anything like that. And that concludes the exam. Thank you so much.